Hello, I am Dr. Juozas Belickas and I am orthopedic surgeon. My way to becoming orthopedic surgeon was quite long and I would say interesting. When I was in my high school, I have an idea to become a doctor. But at that time my sister was a medical student, so I decided not to go to medical school because I thought it was too many medical professionals in our family. So I started my studies in technical university in mathematics engineering field. Somewhere in the middle of my studies, I had very severe knee trauma. After what I was disabled for 1 year. I cannot dance because I had this trauma during my folk dance training, and so I cannot dance for 1 year and didn't have any physical activity. So I started reading books of my sister, medical books, medical atlases, and interesting about my problem, about my knee problem. So medicine became more and more interesting for me. And I started to think, maybe I want to be a doctor again. So I didn't stop my studies in the technological university. So I finished the studies and I became engineer mathematician. The next year I entered medical school. During my first year in the residency, I have a possibility to visit Denmark. At that time, it's the first year of our independence, and I had the possibility to visit Denmark, Gijos hospital, and I stayed in orthopedic surgery department. And I was fascinated about orthopedic surgery at that time, because before I was thinking that I will be a doctor and I will be a head surgeon or vessel surgeon. But after being in this orthopedic surgery department, chief of the department, his name is Göran Lauritsen, said me, "Oh, look, I would like to change your mind from head surgery to orthopedic surgery." And I did that. So after general surgery residency, I finished orthopedic surgery residency. And today I'm here and I'm doing surgeries for the knees, for the shoulders and other orthopedic surgeries. My job is very, very hard, and it requires sacrificing and intelligence, a lot of stress in my job. But I love my job, and nothing can change my satisfaction seeing my smiles in my patient's face and seeing improved mobility of this patient and decreased pains for the patients. So without hobby and other physical activity, it's impossible to remove stress from my life. So I always had some kind of hobbies in my life. So before I was folk dancer for many years, but now I have two major passions: golf and music. I'm playing golf for almost 20 years, and I don't know any better way to relax after my patients, after my hospital, than playing golf, walking in beautiful golf courses, nice people playing with you, and it's gambling, because golf is really gambling sport. I love listen music from vinyls because it's very nice process. It's not as you are walking around and cooking and doing anything, but you just sitting and listening. So I have a huge collection of rock music and jazz music, also classical music. So I love different styles of music, and I feel satisfaction doing that, and I can relax very, very well.